vaccine do is your child will catch some. Your child won't be a severe one.
Most of them visit a doctor.
Severe one, and the child or he or she doesn't need to get admitted now. And the child or you can get cataract. That is, you will not be able to see it.
How does that really affect? Welcome to another episode on Go Mad, Dr. Jagadeesh.
Thank you.
Do you come from a background of doctors?
Yeah, I do. Actually, my dad is a pediatrician,
Okay.
and my mom is a gynecologist.
Wow.
My grandfather was an ophthalmologist. Yeah, my wife also is an ophthalmologist. So yeah, so a lot of doctors in
A
my
lot of
family.
doctors.
Yeah, a lot of
Okay.
doctors in the family. Maybe a little bit of influence of that as well.
Uh-huh.
So yeah, that's.
So there were no second thoughts, if we can put it like that, to
Yeah.
choose your line of
Actually,
career.
yeah. And even back then, I mean, if we had a lot of options back then, there was only very straightforward options, right?
Uh-huh.
It was either engineering or
True.
be a lawyer or a doctor. Or so, but right now you have so many things that you do in in sciences,
True.
biotechnology, dental. You have so many things like that, right?
Right.
But yeah, so that's how the journey was. Yeah.
Nice. So just for the audiences here,
Okay.
could you tell us what do pulmonologists really focus on?
So we focus on all chest-related diseases. So when I say chest, so two main components are the lungs and something between the lungs where your heart is. It's called the mediastinum. Mediastinum. So these are the two areas that we primarily focus on. That is one aspect. Second thing is there is so much burden of TB, tuberculosis in India. So TB can basically affect any part of your body apart from your hair and your nails. Right, so any organ, be it skin, be it liver, be it lungs, be it your eyes. So that is also where we specialize in. So all lung-related, mediastinum-related issues, and also something to do with tuberculosis also.
Okay.
Yeah.
So you don't deal with the heart, right?
So primarily we don't deal with heart, but there are a lot of cardiac issues secondary to the lung, since it's an adjacent organ. But we are not specialists in cardiac related complications. We manage it along with the cardiologists. Primarily, if there is a primary lung issue causing a secondary cardiac issue, then we work with the cardiologist. Otherwise, we don't take care of heart related issues.
Okay. So moving to the very basic areas of respiratory illnesses, right? Could you just highlight on what are the kind of common respiratory problems that you see nowadays?
So the most common one being allergies.
Okay.
Yeah. So specifically in Bangalore, it's called the asthma capital of India. So you have allergy of the lung, which in terms scientifically it's called asthma, right? So there are various other terminologies like people call it allergy, allergic bronchitis, wheezing, but scientifically it's called bronchial asthma. That is allergy of your lung. At the same time, we also encounter allergy of the nose because, as we all know, all the allergens enter to the nose and then goes to the lung. It's a single airway, right? So allergy of the nose is called as allergic rhinitis, and few of them also have allergy of the skin. So it's called urticaria.
Okay.
What people call is also hives, right?
Okay.
So basically these three kind of allergies are the most common that we see. Obviously pertaining to lungs, it is asthma or allergic bronchitis, what we call.
Okay.
That is one thing. Second thing is, your smoking related, which is called COPD, chronic obstructive pulmonary disease. The burden of COPD is, slowly overtaking, asthma. The number of cases also are higher in terms of, asthma. But there is lack of awareness among, even people don't know what COPD is, right? They relate smoking to asthma, they relate smoking, that's why I have wheezing, right? COPD is a completely different disease per se. Then now what we are seeing also is sleep apnea. So sleep apnea is secondary to you're overweight and obesity related. That is one aspect of sleep apnea. So it's mainly caused by excessive weight around your neck. So when you sleep in the nights, what happens is your airway gets collapsed and the oxygen that goes into your lungs reduces practically to the entire body. So mornings you're not fresh, you're not able to work continuously, can't concentrate, lack of memory power, and sometimes most of them doze off while driving. So this is one that we are seeing in our lifestyle disorder that we are seeing. Obviously there are other causes of sleep apnea, but most commonly it's obesity. Then we have multiple other things. Again, TB, I will not still ignore tuberculosis. Still the burden is high in India. But the government is doing a lot of work in terms of giving free medications, educating about the disease. In fact, they're also giving to poor people, to all of them, 500 rupees per month, so that because diet is most important factor. Apart from the medications, you need to have good diet. So they are also giving like 500 rupees every month. So TB is also one high burden disease. So I would say these four constitute the most 80% of our volumes. The other diseases are like interstitial lung disease. That is one of the new disease. You see something called as hypersensitive pneumonitis, especially in societies. One of the main trigger is pigeon droppings and pigeon feathers.
True.
Right? So that's called bird fancier's lung or hypersensitive pneumonitis. There's another something called a sister disease of TB. It's called sarcoidosis. So these are the other diseases that also we deal with.
Okay. Do you see a rise in all of this now?
Yes, we see a rise in all of this primarily because one is the technology has advanced.
Okay.
Right? So the detection is higher of all these diseases. Now people are coming to a pulmonologist, specifically to a pulmonologist. Obviously, if someone asks me about heart-related issue, I wouldn't know, right? I would tell no, it's maybe something else. But unless they go to a cardiologist, you'll know. So since now you have a specialized field and it's upcoming field, pulmonology, so we know these diseases, we detect them early. There are multiple other tests which have come in. So the detection rate is higher. So that's why we see this. Obviously, the population also is increasing, so we see more number of these cases now.
Yeah. Right. So, if you could categorize them basis age of patients that you come across, right? What is that one most common issue that children come to you when it comes to lungs?
Okay. So the most common, even in children, is allergy.
It's allergy.
It's still allergy. There are certain kinds of infections, children can catch, especially viral, during the, monsoon period. But I would still say, it's allergies that play, that is most commonly seen in children, at least in my practice. So when I say allergy, again, typically they'll have symptoms like cough, wheezing, running nose, sneezing, itchy eyes. So I would say most of the patients, children especially, have these kind of allergies. So what triggers this is, it can be a viral infection, it can be, pollens, it can be some house dust mites at home. So anything can be a trigger. But in my practice, I still see most of these patients coming.
To be allergies.
Children, allergies.
Is there one tip that you can give for parents that you can, I won't say cut out completely, but how you could control anything that triggers these allergies for children? Any home remedy or anything to just flow through during these seasons so that it doesn't really trigger too much? Yeah.
So one thing is at home, precautions at home that you can take will help a long way. Is simple things like if you have a carpet, remove it or vacuum it regularly. Cleaning your bed sheets. Use only cotton, no woolen or cotton. Only cotton quilts, no woolen or rugs. No stuffed toys in the room, especially if the child is more prone for this cough, allergy. Cleaning the fan, changing the AC filters. If you have pets at home, because animal hair and dandruff also can trigger. Someone smoking at home, ideally no. Also these strong perfumes or strong these agarbattis. So try to avoid all this. So this is completely doable at home, but once they step out, it's not under our control. So that is one thing. Second thing is be up to date on the vaccinations. Obviously, all the vaccines at each age group at different levels. So that is one thing which can help. So
does
these
that
two
really
things
help in immunity for children?
Yeah, it definitely helps.
Okay.
We have seen a decline in especially infections. So generally what we see is a typical seasonal allergies and infections. So when there is monsoon coming in, we know that these kind of patients will come in to expect these, but that is changing now. Mainly thanks to vaccines, because mainly what does vaccine do is your child will catch some kind of infection, but it won't be a severe one, and the child or he or she doesn't need to get admitted in the hospital, right? So it could be a simple OPD visit, see, get some medications and go back home. So in that way, vaccinations help a lot.
Okay, so up-to-date vaccine is a must.
Yes,
is what you're saying.
up-to-date vaccine is a must.
What is your take on the flu shots?
Yeah, flu shot. Yeah, so mainly the flu shot. It's not only for children, even for adults. Adults across all age groups. Flu shot is definitely a must. Mainly the what we call the H1N1 vaccine or the influenza vaccine. So it's yearly one dose.
Yeah.
And definitely I would recommend for everyone.
Not just children, you say?
Not just children, yeah.
Okay. So since we're talking about kids, right? Cold is a very common, thing that children catch.
Yeah.
How long do you think parents should hold on before they visit a doctor? Because every month, almost every second week, the child is prone to catching a common cold.
Correct.
Is it really common cold, which is okay? Or when is it that we know, okay, this child needs a doctor's attention?
So one simple thing I'll tell, if the child is active and the symptoms are lasting for 48 hours, it's okay. You don't have to worry, right? Sometimes they'll have fever, sometimes they'll have some cough, running nose. But the child is active, child is hungry, eating. But if the child is slightly, dull, normally, if it's their playtime, and they're like, no, I don't feel like going, or the fever is little persistent, going on more than 48 hours, I would say, better to meet a doctor. So 48 hours and see how the child behaves, the child's behavior.
Okay.
If they're like the routine, they're following their routine, then you don't have to worry. But if they're little dull, not going out, or they tell they're tired and fever spikes more than 48 hours, yeah, better to meet a pediatrician or a pediatric pulmonologist, depending on the symptoms.
Seriousness.
Yeah.
Do you suggest any home remedies for cold?
Okay, for kids, I would just say, maybe warm water, something
as simple as that
as
is
simple
enough.
as that. Maybe a spoon of honey and nothing more. Don't try too much. Some of them put too much salt. The kid will have no taste. Then they will not eat. So all this, so I would say hot, warm water with 1 or 2 spoons of honey.
Okay.
Yeah.
Moving to the youth and a little middle-aged population, right? Most of them get into smoking and
True.
habits like that. So how does that really affect your lung?
So absolutely, smoking is a big no, because it not only affects the lung, it can cause heart attacks, it can cause lung cancer, it can cause COPD, it can cause oral cancer, it can cause stroke, you can get cataract, that is, you will not be able to see at an early age. So
because of smoking?
Yes, even because of smoking. Okay. So generally what happens is, whatever you smoke, it enters the bloodstream, right? So so basically it's a poison, right? So anything that enters the bloodstream can affect any organ, right? So but the most common ones are your COPD, your lung cancer, and your heart attacks, or technically what's called as myocardial infarction. So these are the 3 main things. Now people are also trying out different alternatives like vaping, be it like hookah. So recently even WHO has come up with guidelines that all are equally harmful, because they have some flavored substances, they have some other smoke which can also cause cancers and COPD.
Okay.
So, and just to give you a perspective of how dangerous hookah is, so 1 hookah is equal to smoking 200 cigarettes. So if you sit and smoke 1 hookah, it's equal to smoking 200 cigarettes. So any form of smoke inhalation is bad, be it cigarettes, vaping, or hookah.
What other kind of respiratory issues do the middle-aged actually face? Because they start stepping out.
Yeah.
They're out. I think air pollution plays a really major role, right?
True.
So what is it that we can do, and how is it that it affects?
So yeah, so sometimes some things are out of our control because we need to step out, we need to go to work. But small precautions. So as you rightly said, air pollution is one which is on the rise, especially when you see in the northern part of our countries in Haryana and Punjab and Delhi, because of the stubble burning and the AQI, that is air quality index, goes up. So one thing that you can do is, is it possible to work at home for IT people, or if there is a possibility like that, and if they have a pre-existing lung disease, right? Sometimes if they go out, if the air pollution is too much, they can have an exacerbation. So what they can do, they can check for the air quality index before they step out. Anything less than 50 is safe, right? 50 to 100 is okay, moderate. So they have different green. So less than 50 is green, 50 to 100 is falls under orange, above 100 is red, and then you have purple, maroon, so it goes up, right? So if you are fine, up to 100 is is breathable air with no, you won't have any issues. Less than 50 is good. So today's, I was just checking, Bangalore's air quality index was around 25, 26, which is actually good. So that is one thing that you can check on. Yeah.
As a pulmonologist, I just have a question that just struck. So do you really check air quality before you step out?
So yeah, no, I don't
Does
check.
it bother you? Like
No, it doesn't bother me specifically because I work close by my house. My house and office and my hospital is close by. So, but yeah, why I happen to check is when I check news, so it happens to be there. The top 4, 5, 6 metropolitan cities. What's the air quality index? So that's how I just see. Otherwise, no, I don't have a habit of checking air quality index. Yeah.
On a serious note, like if you're living in a city like, for instance, Delhi, with your air quality index actually being bad, you have no option. You can't move out and you're breathing that air. Is there something that people can actually do to revive out of the kind of air that you're breathing in and the damage that it causes to you?
So yeah, it's practically very difficult, but there are few choices that we have that we can do. So one is at home, have a good air purifier. So we'll come to that later, since you asked me once you step out what precautions that you can take. One thing is using a good mask, right? An N95 or an N99 mask, especially in those areas where AQI is. But the best is a respirator. So a respirator basically purifies almost 100% of the particles that is there in the air. So maybe if any one of you would have seen, if you would have stepped into a hospital during COVID times, most of the doctors were using these respirators. So they have like cartridges with you. So, or you would have seen these, in movies when they enter some coal mines and all. They'll be wearing these huge ones, huge masks. So those are called respirators. So those you can, wear. But yeah, it sounds very odd or looks very odd that when you step out with a respirator. But masks is one thing. You can either use an N95 mask or an N99 mask. That will help to a very good extent. Obviously, once you are inside, closed spaces, office spaces, again, as I was telling, if they have carpets, better to remove them or vacuum them. How is their air filtration system inside the office? Because there is something called indoor air pollution, right? That we have to be careful of. So these are the things. If someone has some even from offices, they come. I was sitting at the office. They switched on the AC and I had an attack of. So better to have air purifiers even in the office space.
Okay. How affordable is a respirator?
So generally what we use and what I am aware of is the 3M company respirator. So the respirator costs around some 2,000 to 3,000, and the cartridges you need to change. So each cartridge costs around 1,000. So yeah, the entire thing maybe around 4,000 you get a respirator. So that's the typical price of a standard company like 3M.
Okay. Not something which is very affordable for a lot of people, right?
Yeah, true. Yes, that is there.
That's hard.
Yeah, that's hard. Until unless, I mean, if you are working in a environment where there's a lot of fumes and all, the hazmat suits and the respirator are provided by the company itself, but most of them don't do, right? Most of them go to offices or other workplaces. For them, an N95 or N99 proper ones.
Is it?
Yeah, it's around some 100, 150, 200 bucks. So, yeah.
Because we spoke of children and the middle-aged. Is there something specifically that elderly people are prone to when it comes to lung diseases?
So my prof always used to say that children and elderly are the same,
Okay.
right? Be it in terms of having a disease or being in terms of being cranky, right?
True.
So both of them are the
Very
same.
true.
So they are more prone for infections, and they are also more infections per se, because most of them nowadays have diabetes, hypertension, some kidney related issues or pre-existing lung issues. Right, so they are more prone for infection. They'll be on some medications which can reduce their immunity. Some of them, recently diagnosed with cancer. So cancer medications also can, bring down your immunity. So for them, I would say most of them watch out for infections. So how do you prevent them? Again, vaccinations is a must.
For the elderly, is it?
Yes, it
What
helps
are
a lot.
those vaccinations?
So I'll be specific to lung related
Sure.
vaccines. So now we recommend 4 different types of vaccines. One is your flu shot, that is the annual vaccine. So the flu shot will take care of only the viral infections. The second one is your pneumococcal infections or pneumonias. So those are called pneumococcal vaccines. We have 2 vaccines for that. So that depends upon the patient and what the patient has, right? If patient has some other comorbids, we give it back to back. Otherwise, we give one and we give another one after a year.
Okay.
The third one is a Tdap vaccine. That is, it's basically tetanus, diphtheria, and pertussis vaccine. That we specifically give it for people who have severe comorbids, like patient who smoked a lot, who has a severe COPD, patient who was on multiple immunosuppressive drugs. So that is one shot. And the fourth one is the shingles vaccine. That is the herpes zoster vaccine that we have. I wouldn't say recently.
Quite
Maybe it's been there for 2 years, 3 years, 2 years I think in India. So that is another vaccine. So these are the 4 vaccines that we, advocate for elderly, especially with, comorbids.
When you say elderly, what's the age band?
So elderly, so again, for influenza vaccine, anyone above 50. For pneumococcal vaccine, again, anyone above 50. So most of them, I would say above 50, they don't fall exactly under the elderly bracket, but for patients who have comorbids above 50, we would recommend.
So one of the common things that we hear is people who smoke are the ones who get cancer in the lung.
Yeah.
Is this true?
Yes, the probability of someone getting cancer who smoke is definitely higher compared to that of who don't smoke. But there are also other factors which can cause, cancer of your lungs. Obviously, smoking is one. Second one is genetics. Someone who at family history, basically someone at home already had. Your third thing that generally people tend to ignore is secondhand smoke. Right? Passive smoking can also cause cancer. But the probability of someone getting cancer is higher if you smoke. Yes.
Okay. But it's not true that only if you smoke, you will get lung cancer, right? Anybody is prone to it.
Yeah, anyone is prone to lung cancer. Now, even there are studies which say you're exposed to, fumes, work-related, occupational lung disease, what we call, they can also have cancers. You're exposed to bad air quality for long periods can cause cancer. Non-smokers, most of them who come, they're very disappointed that we have never smoked, but even it can happen, cancers can happen even in them. Lung cancer can present in many ways, right? One is obviously a primary factor being, smoking. Second thing is, say for example, in a woman, if they have breast cancer, again they can have lung cancer, secondary to the breast cancer, right?
Okay.
It's a different form of cancer. Some of them have kidney cancer. They can, in the late stages, can present as a lung cancer as well, right? The main, we would say the main lesion, cancerous lesion, can be in the liver or in the kidney, but because since it spreads to the blood, so they can be presentation. They can have cough first, right? So they come to you with cough. You will know that there is something going on in the lungs which looks cancerous, but you will have to look out for which is the primary organ which is involved, right? Is it the kidney or the liver? Sometimes by looking at the scan itself, we'll know this is a primary lung cancer, and then secondary or metastasized to other organs. So those are the different kinds of presentations that we generally see.
Okay. How important is it to diagnose persistent coughing?
Very important because it can be anything, right? It can be due to a simple allergy. It can be due to smoking. It can be due to cancer. It can be due to your drugs because some of the antihypertensives, mainly, and it can also cause cough. It can be due to non-lung issues like something in your abdomen, which can also cause cough. So it's very important to diagnose cough. Again, what would be the timeline? Ideally, what they say is 10 days to 14 days, that is at least 2 weeks.
Okay.
Any cough persisting for 10 days, I will reduce it to another 4 days because something if you pick up early is better, you're saving time, right?
True.
So generally they say 2 weeks, but yeah, the early the better. If it is for a week to 10 days, it's irritating, bothering you, then better to come and, see someone.
Okay. Moving on, when it comes to anything to do with lungs, right, there's a huge landscape difference post-COVID.
Oh.
A lot of people had their oxygen levels going down and the lung capacity has reduced is what lot of common men tell, right? How has it changed the kind of problems that you encounter from patients post-COVID?
So post-COVID, one thing apart from having all the lung issues, I would say awareness has definitely increased, right? Any lung-related issue, people initially used to go to a general practitioner or used to go to a physician nearby telling give me something, but now at least I see it's definitely improved. It has to get even better. Now people walk in directly to a pulmonologist telling that I have a lung issue or I have cough or wheezing or whatever it is. So that is one. Awareness per se, definitely it has improved. Second thing I would say, especially as you were telling, people who have been in the hospital, oxygen have been low, they've been on oxygen supplementation or on ventilator or something called ECMO. For most of them, the lung has healed itself, right? If I would say 100 patients who are admitted in the hospital on ventilator, I would say 90-95% of them are back to their routine. Right, even though we say the lung has been damaged, but that with time, slowly lung has healed in most of them. There are, subset of patients, maybe I would say 5 to 10% of them, wherein they have long COVID symptoms. So that could be symptoms like I used to work out for 1 hour, now I'm able to do only for half an hour. Right, I do small activity, I'm out of breath. Right, they are more prone for infection. So every year they come back. When you do an X-ray, there's a small patch of pneumonia, a small patch of infection in the lung. So for 5 to 10% of them, their immunity has slightly come down. Their exercise capacity is reduced. The lung function capacity has reduced. More prone for infections. So there are subset of patients, but luckily this is only a small subset who were required hospitalization because during COVID time we used to only hospitalize people who required oxygen, whose saturation levels were low. Right? In them also they were moderate and severe category. Moderate, generally ward admission, some oxygen, they used to stay for a few days and they used to get discharged. The severe category used to be in the ICU. So we see these long COVID symptoms in the severe category patients.
Okay. But looking at the lifestyle now, right? During COVID, I think most of us ended up having a sedentary lifestyle because we were not able to do anything. And even people who are healthy are now finding it difficult to do things.
Okay.
Things that you said, like, lack of, not able to have good breath or running out of breath, I would put it that way. Is it really those who are severely affected only who are facing this, or in general everybody? Because I think most of us, I won't term it laziness, but it's put us into one sort of slow, how do I put this? It's not very, we're not back into our original shape, right?
Yeah, we're not back into the same rhythm that we were there before. Yeah, I understand that. And very good point that you have mentioned, because I was sticking only to the lung point. But as you said, people who had mild disease who won't recover at home, some of them have long COVID symptoms. So when I say long COVID, they have some joint pains, easy fatigability, they're tired. So all these symptoms do exist, but unfortunately there is no specific medication or anything for that, right? So there are people, as you rightly said, lung perspective, mild patients who recovered at home, I don't see much.
Okay.
Right. It is these other factors, other symptoms that we encounter, I'm easily tired, my joints hurt, especially the smaller joints. I try to write, something, a poem or a paragraph, and my joints hurt. Small activity at home, I get tired, I'm not able to drive. So that I've seen in patients with, even with mild COVID who have required at home. But I don't see patients with mild COVID having some lung issues. Uh, so even if they have, generally most of them gets picked up by doing a pulmonary function test on an annual health checkup. We do so if it gets picked up in that, then we treat.
Okay.
But it is not very severe that it affects the day-to-day activities.
Okay.
Right.
So what you're saying is COVID as such has not really pulled down the lung life of majority of people, or
Yes.
they've healed out of it, is what you're saying.
Yeah. Most of them who have severe COVID, moderate severe, requiring oxygen, as you said, the lung fibrosis, what we were expecting. Normally, fibrosis is simpler terms is called a scar. So you get a hurt and there is a scar, right? So there is a scar which forms in your lung whenever there is an infection, right? So that scar also has miraculously healed.
Okay. In people who have had COVID.
Yeah, COVID. Most of them at least. But there is, as I said, a small subset of patients who have post-COVID complications, sequelae, who have lung issues. For them, they'll have to be on medications, inhalers or oxygen even now. That's a very small subset, but most of them have done well.
Has COVID vaccines really helped?
100%. I would say COVID vaccines definitely has helped. Because I have seen my own colleagues, their lives being saved. I have only treated most of them who were admitted, who've taken one COVID vaccine, because we were given first. If you remember, healthcare workers and people who were exposed were given first. So we were given one vaccine, and after a month, a second dose was given. So even with one vaccine, people who have required oxygen have recovered. So definitely I would attribute it to the vaccinations. Not only COVID, even the other diseases. I've seen elderly who are vaccinated with small pneumonia, they get discharged in 2-3 days. Who are not vaccinated, they stay for longer durations in the hospital. So COVID vaccine definitely has helped.
Okay. Since we are talking of COVID and you've given quite a lot of information to audience, I'd want to tap something about how you've dealt with as a doctor during those times. Was it really hard?
Yeah, it was definitely hard. It was taxing not only physically but also mentally, because even it is it's a place that even we don't know, right? It's a new disease that we are also not aware of. We don't know, not only in the patient perspectives, because sometimes we are all humans at the end of the day. So we also have fear. We also have, okay, what if I catch and what if I am there? But yes, it was mainly more not only physical but also mental. So all of us used to have scars over the nose, because of the respirators that we use. We used to get tired soon because we used to wear those 2 layers, what we call the PPE kit. So we used to sweat a lot and get dehydrated. So it was definitely a tough, challenging time. So thankfully, at least most of us have come out of it, healthy, and it's good. So and it's once in a lifetime experience even for us for treating. We will maybe not see, at least in the next 50 or 100 years, something like COVID. Hopefully not. But this, something once in a lifetime experience, something new. Both physically and mentally taxing, right? So, So we've come out victorious, but let's see.
It's been tough.
Yeah, it was very tough, yes.
Okay. So are there proven ways to improve your lung health post the COVID season?
So there are a few ways where you can improve. Again, it's not very difficult. Some exercises like pranayam, deep breathing exercises, your routine, physical exercises that you do, maybe running half an hour in the morning, in the evenings, can improve your lung function. So these are the proven smaller tips that I can give, because few of my patients have told all this have helped them and benefited them, post COVID, to recover from COVID faster.
Okay.
So these things are,
Okay. What are the biggest misconceptions people have when it comes to using inhalers or antibiotics for anything to do with respiratory diseases?
Okay, so very good question, because most commonly, abused thing is antibiotics, right? Any cough, cold, they start antibiotics. Never ever do that because it's not going to help. When you have infection, you have fever, take antibiotics. As simple as that. Infection, fever, antibiotics. No infection, no fever, no antibiotics. So if you have a simple cough or cold or sneezing, that is not an infection. That is an allergy, right? To something. It could be anything. Could be dust or anything like that. So never take antibiotics during those times, because one thing is this antibiotic abuse, what it leads to more resistance. That means the bacteria gets more stronger towards the antibiotics. So people who really require that time, when they catch the same infection, it doesn't work. So when we have allergy symptoms, don't take antibiotics. When you have to take antibiotics, say for example, okay, you're in the night, you have a lot of cough, then you have fever, then yes, then you can take antibiotic. Obviously at that time, if it is very high, you come to the hospital. Otherwise, you can start a course of antibiotics. So antibiotics is, please reserve it only when you have some kind of infection which is leading to a fever, and then you take antibiotics. Now inhalers are specifically for people who have symptoms like cough, symptoms like wheezing, they are out of breath when they walk. So inhalers are the best medications. They are safe, they have no side effects because they are inhaled medicines, they don't enter the blood. Right?
Okay.
So when you take an inhaler, it goes only to the lungs where it's supposed to act. So it stays only in the lungs, right? Obviously, there are different other things like the inhaler technique should be right, the amount, the dose of the inhaler, all that matters. But inhalers are very, very safe, and they are not habit forming or addictive.
That's the myth, right?
Yeah,
if you take it once, you cannot take it out. You have to continue to use it, is what.
Yes, yes, that
say.
is the common thing that they say. But it is like any other medicine, right? If you're antihypertensive, you're on antihypertensives, like for BP, if you're taking some medications, it is not that you take only when the BP is high. You need to take it daily so that it's under control, right? Similarly, it goes with patients with cough, wheezing, who are known cases of COPD or asthma. If you take it regularly, you can do all your activities regularly. You don't have to come to hospital. Even visits are like 6 months once or 1 year once if you're absolutely fine. You don't have to come frequently. It is not habit forming or addictive like you're smoking or alcohol. Okay, even if it's habit forming, it's a good addiction, right? So that your lungs are healthy. You don't have to sit at home because of some cough, wheezing every month. You don't have to come to the hospital. You don't have to spend money there, right? So it's not habit forming or addictive.
So is there a difference between wheezing and asthma?
So a symptom of asthma is wheeze, right?
What is wheezing then?
Wheezing is an audible sound that you hear from your chest when you're sleeping or when you run or when you're walking. If you hear a audible sound like a cat whispering or a whistling kind of sound from your chest, is called a wheeze.
Okay.
It is not a disease. It is a symptom. Right, like just you have say for example there is a patch in the lung. How your body reacts is by having fever, right? It is a symptom of an infection. Fever is a symptom of an infection. Similarly, wheeze is a symptom of having asthma or allergy of your lungs.
Okay.
Right.
So wheezing doesn't always mean you have asthma. Is that what you're saying?
Wheezing doesn't always mean you have asthma, because vice versa also.
Asthma doesn't mean you have a
no. That in the sense like not all asthmatics wheeze.
Okay. Okay.
Right?
Got it.
Because asthma can present even as dry cough. Someone has dry cough. That is something called cough variant asthma. So they have only cough and no other symptoms. Some of them have only difficulty in breathing, right? Especially early in the mornings and late in the nights. That is the time, those are red flag signs. They won't have cough, but they have only difficulty in breathing.
Okay.
Later on, wheeze starts showing up, right?
Okay.
So, as you said, not all that wheezes is also asthma, because sometimes wheeze can be due to sudden exposure to dust. You might have some wheeze and then suddenly it's, dies down.
Okay.
So.
Okay. So, doctor, you had mentioned about inhalers being very good because it directly goes into the lung, right? What exactly is an inhaler? What does it contain? How frequently can you take it?
So inhaler is an inhaled medicine. Basically, there are different compositions of what is there, the medicine composition in an inhaler. There is a steroidal inhaler, there is a non-steroidal inhalers.
Okay.
Okay. Both are equally safe. So mainly people have a lot of doubts regarding steroidal inhalers.
Correct.
But as I was telling, they are inhaled medicines. So even if inhaled steroids given at a higher dose is life-saving, right? Because we can avoid hospitalization, we can avoid oxygenation, we can avoid ICU, because most of them, they fear that there is steroid we don't want to take, and they'll land up straight in the ICU with oxygen being low.
Okay.
Steroidal inhalers are life-saving medications. They are the cornerstone for asthma treatment. So obviously the dose depends upon the severity of the disease, how frequently the person has cough, wheezing, what is their pulmonary function test values. Depending on that, we adjust the doses. But they are very, very, very safe compared to your oral. Because if you don't take inhaled steroids, when you get admitted, we have no other option but to give IV steroids, right? So long term, they have more side effects, right? So if you take inhaled steroids, obviously the doses are moderated by your pulmonologist, you will avoid all this other complications.
Okay. And can you really take it frequently?
Yeah, normally inhalers who have issues regularly, you have to take it frequently, just like your diabetes and hypertensive medications, you have to use it regularly. Slowly, what we call is the step down therapy. Depending upon the symptoms, again pulmonary function test, we slowly come down on the dose, but they have to be taken regularly, yes. Or at least some of them have something called a seasonal asthma. So when the weather changes during monsoon times, only that 1 month they have issue. Only specifically for them, use it during that 1 month and then stop. Right?
Okay.
But if it's a chronic thing or a perennial thing, you should have to use it throughout the year.
Regularly. Okay. So it's safe. That's
Yes.
what you're saying. What about nebulizers? Are they safe to use? Because most often it's for kids or the elderly that we end up using nebulizers, right? So are they really safe?
They are safe, and you've only answered the question. So it's basically we have recommended for kids or for elderly.
Okay.
Mainly because the only challenge with inhalers is the technique of inhaler, right? So you have to use it properly for the drug to get deposited in your lung. You need to press, you need to take a deep breath, hold your breath, exhale out, and you need to repeat that, right? And most of the times inhalers are once in the morning, once in the evening, once in the night, right? So you have to get the technique, the coordination right. The best part of a nebulization is you don't have to do anything. You have to just put the mask.
Breathe.
Because most of the children and elderly, they don't have that coordination, right? The hand and mouth coordination. For them, or for very sick, some of them are bedridden, right? For them, nebulization is the best, because just like how you're breathing, you just switch on the nebulizer, just put the mask on, and it just goes in, right? So we generally recommend that for children, elderly, or with people who are bedridden.
Okay. So pretty much the inhalers and nebulizers do the same thing.
Yes. Both do the same thing. Both mostly will have the same medicine. Only thing is it's a different form of inhalation.
Okay. Okay. Yeah. What about humidifiers?
So humidifiers we generally don't recommend regularly. The only strong recommendation that we recommend humidifiers is some of them for sleep apnea or on some devices called a CPAP device. Right, it's a therapy for sleep apnea patients. That gives dry air, right? Okay. So when you're inhaling dry air, obviously you'll have nasal crusting. Your throat gets dry. Sometimes the nasal crusting. Sometimes what happens, you start bleeding. You'll have nasal bleeding in long-term patients. For them, we connect a device. It's a humidifier. Right, so it humidifies, it gives moist air, so that you don't have all these symptoms. Generally, we don't recommend humidifiers.
Sleep apnea is in the rise. What are your thoughts about it?
So yes, so as mentioning, definitely on the rise. Sleep apnea, again, most of it is lifestyle. It's a lifestyle disease. Now, what happens in sleep apnea is during sleep you stop breathing. So that is sleep apnea. Apnea is a technical term when you stop breathing, it's called apnea.
Oh, okay.
Generally, when we sleep, we stop to breathe. If you stop to breathe around 4 to 5 times an hour, it is considered normal, right? That is the normal physiological mechanism. Some of them stop 2 times, some of them stop 4 times, some of them don't stop.
Everybody stops?
Some of them, yes. Some of them we stop breathing for a second. Suddenly we get up, you're out of breath. So we sometimes, that is again choking. If it is severe, you getting up, it's a choking. That again has, it's a symptom of sleep apnea. But generally, less than 5 times in an hour is considered normal. Now, whom do we see in first is generally obese individuals. Your BMI is very high. You have fat deposition around your neck. Some of them have, short neck. So these kind of, patients have sleep apnea. Now, what are the symptoms of sleep apnea? Most common is snoring, loud snoring, choking, that suddenly they have that jerk and they get up, choking. Then early morning they are not fresh. Early mornings they have headache, easy fatigability and tiredness, and also excessive daytime sleepiness. So they'll be sitting watching TV, reading paper, and they fall asleep. They'll be in car, driving, they fall asleep. Then their memory power also reduces, poor memory power. So all these are the symptoms of sleep apnea. Now, as I was telling you, sleep apnea is commonly a lifestyle, mainly because of obesity. And how do we diagnose sleep apnea is by doing a simple thing called as a sleep study.
Okay.
So basically what we do is there is a small a device that is connected around your chest, which records your sleep pattern, which records how loud you're snoring, what is your heart rate, what is your oxygen level, which stage of sleep you're in, and depending on that we calculate how many times you're stopping to breathe, to put it in simpler terms. And then we have 3 different categories called mild, moderate and severe, and then we advise what to do next.
Okay. Why is it on the rise? Is it just because of the lifestyle you're saying?
Yes, it's because of the lifestyle. Most common sleep apnea, what we call as obstructive sleep apnea. There are 3 different types. One is obstructive, one is central and mixed. Right? 3 types of sleep apnea. Obstructive is the most common. So if I see like 10 patients, 8 of them have obstructive sleep apnea. The other 1, 2 will have a mixed pattern. You have obstructive and central. So obstructive is mainly because of overweight, obesity, obstructive, or short neck. So all these factors. Second one is your central sleep apnea is mainly to do with something with your brain. So you have some neurological issue that can lead to sleep apnea, and that can cause
neurological issues like what?
So some of them are on some drugs, for example, for epilepsy, for some tumor in the brains. So that can also, since brain is the main center for all the organs to function, mainly the respiratory part of it is affected. That time they can have something called as central sleep apnea. All right. And third one is called a mixed variant, where they have both of obstructive and central.
Okay.
So these are the common things. Now, how do we treat it? What category they fall under? If they fall under mild, generally we advise them to lose weight, right? Because it's a reversible disease. Yeah. And moderate and severe, we advise a device called a CPAP device, wherein basically what it does is, whenever you stop to breathe, the device gives you air.
Oh, okay.
Right? It gives the breath, so that the device is breathing for you whenever you stop to breathe. So if you stopped like 50 times, 60 times an hour, we have seen patients, then that time the device gives that breath so that it helps you breathe.
Can Fitbits and devices that help you track your sleep patterns, right, do they help in diagnosing sleep apnea?
They help you identify signs that you might have sleep apnea but not diagnose, because you need to, if you have to get diagnosed, you will have to get a proper sleep study, sleep evaluation done. But definitely it will give you parameters like, one is your sleep quality, how many hours you slept, and that it gets recorded. Second thing is your saturation also gets picked up. Right? And your heart rate also gets picked up. So for some of them, their oxygen falls during severe stage of sleep apnea while sleeping. So that data also gets recorded. So you will have an idea about, yes, maybe these are the symptoms, along with your symptoms like morning you're not fresh, fatigability, your loud snoring, your partner complains of snoring, all these. Then yes, it gives you an idea that you might have sleep apnea. But to diagnose it, we have to do a sleep study.
Sleep apnea and snoring are 2 different things, right?
Yeah.
Is it okay to snore, or is there something you have to look into if you're somebody who snores?
Yeah. So snoring, not all snoring is good, right? If you have snoring along with other symptoms, definitely you have sleep apnea. So you have to get yourself evaluated. But continuous snoring, there is a different pattern of snoring along with choking, very loud snoring. So all this, you have to get yourself evaluated. Yeah.
Okay. Many people open their mouth and sleep, right? Is that good for the lungs?
Generally what happens is it's nothing like it's good or bad for the lungs. Only if when you're opening your mouth and taking deep breaths, sometimes what happens is you'll have dryness of the mouth. Apart from that, there is nothing like you have to open or close your mouth and sleep.
It's okay to open your mouth and sleep?
Yeah, it's okay to open your mouth and sleep. Ideally, what I would recommend is maybe if they're opening their mouth and sleeping flat on their back, recommend them something called a sleep hygiene. So you either sleep on your right side or your left side. Keep a pillow behind your back. Some of them keep stitched tennis balls if they have sleep apnea, mild sleep apnea. They're losing weight, right? So they sometimes have tennis balls stitched behind their t-shirt so that they don't lie flat, right? Is it either on the right side or the left side? Maybe a little more crude way to not sleep, but still, yeah. So for some of them it has worked. So I would recommend that, right? Either sleeping on your right lateral or left lateral, or keep a pillow so that you don't have to open your mouth. Maybe it's an indication that you're not taking in more air. So that's why you're open your mouth and breathing.
Okay. One thing that people do thinking it helps lungs, but it actually doesn't.
So people do many things. The list is endless.
Okay.
So I have seen people when we have, so it's just a small funny incident. When we recommend inhalers, right? So they go back and then they come telling that we are not better. So I have scratched my head thinking that why it's not better and all that. So I tell them, okay, normally when you ask anyone to come back follow up, we tell them you carry your inhalers because as I told, the technique should be right. So we always check because it's not like a medicine that you just pop and it goes to your stomach and it works, right? So this gentleman, so it comes, so we're discussing it, not better only, I've come to you for 3 times and all that. I told, okay, show me your inhalers, let me see, maybe we can change. So he pulls out a Vicks inhaler because that is also an inhaler. So there are so many things like this, right? So inhaler, I inhale and he keeps doing that and I told, okay, good, you go to someone else, whatever I tell you, you will not listen. So but there are also other things like people, again, steaming is one of the most common thing, right? They take steam telling that should help. Some tell early morning at 5 o'clock, 4 o'clock, you go outside, cold breeze, nice breeze, because for some of them cold breeze also can trigger asthma. So all these techniques won't be as helpful.
What's worse for your lung? Is it the air pollution or passive smoking?
So yeah, both are harmful. I can't tell.
What's worse?
I would say air pollution only is depends on the exposure also, right? If you're constantly being exposed to someone who are smoking is more harmful, right? Sometimes air pollution, at least in a city like Bangalore, most of the times, at least the recent trend what I've seen is the air quality is good. So if you're constantly exposed to second-hand smoke, obviously that is more dangerous. But if the air pollution is way too high, air pollution on a daily basis, someone, for example, for a traffic constable or traffic person, someone in Gurgaon or Delhi, that area where air quality index is very bad, for them, yes. But generally in a city like Bangalore, air quality index never goes very bad. It's the second-hand smoke which is more dangerous.
So wrapping up this wonderful conversation, what's that one thing that you would tell people to do and one thing that you would tell people not to do when it comes to lung health?
So lung health, generally for people who have underlying lung disease per se, don't ignore your symptoms, one thing. Don't brush it off by telling, okay, it's some infection and take some antibiotics. Any cough, wheeze lasting for even for 3-4 days, not getting better. You meet a pulmonologist, that is one thing. For people who have underlying lung diseases, vaccinations is life-saving. Please take vaccines. There's a lot of myths that vaccines can cause this, that, but vaccines do save lives. People who are on inhalers for any lung issue, Again, inhalers are cornerstone, they are good medicines, they have no side effects, they are safe compared to other alternatives that are there. These are the things, you know, that I would recommend. Obviously, some things not to do, very obvious is not to smoke, right? Not to inhale some fumes, stay away from, you know, where there's a lot of smoke, pollution, all that. Follow some small things at home, because as I was telling, there's something called indoor air pollution. So also at home, take some precautions. So these are the things, you know, that because lung is a major organ which will oxygenate your entire body, right? It's like what you inhale is goes to almost all parts of your body.
True.
So obviously take care of your lungs, because most of the lung diseases are irreversible, right? There is only control. There is no cure for most of the lung diseases. So you wouldn't want to be on oxygen or medications for a longer time, requiring so many other things. So at least the preventable ones, one main thing again on the rise is smoking. So if you can prevent that, yeah, your lungs will thank you when you are 60, 70, right?
Sure.
So that's the message that I want to give.
Thank you. Okay. Thank you for that wonderful conversation. Lot of information for everybody out there. Thank you for taking your time out and being that genius behind the stethoscope. So that's what I'm going to introduce you as.
Okay.
So thank you so much once again.
So thank you for the opportunity. Thanks a lot.
Our
I
pleasure.
hope this, you know, reaches as many people and it helps people. And yeah, thanks once again for having me on your show.
Thank you.